My name is Thomas Fekete. I'm the professor and chair of medicine at the Katz School of Medicine at Temple University. Now everyone's heard about the coronavirus. Sometimes it's called SARS coronavirus 2, other times it's called COVID-19, all the same thing. It's a virus that can be quite severe. It causes mostly respiratory infections, usually pneumonia. Some people have very mild or no symptoms. Other folks get moderately ill, and some people get extremely sick and require hospitalization. It's been sweeping around the whole world. I think almost every country has experienced it, and in some places it's become very devastating. Best understanding is it spreads from person to person, usually through the respiratory tract. We think that it can also spread by people touching their face, touching their eyes, touching their nose, and then the surfaces that they were touching before may have some virus on them. So it's a combination of direct coughing and then some degree of touch, usually of your own face and including your eyes and nose. Beginnings of some experimental vaccines. They really haven't been tried in more than just a few people, so I think we should look forward to that. It may take weeks to months, maybe even a year or more before we have a commercial vaccine. Treatments are supportive mostly. We give people oxygen if they need it. We give them support with other equipment, including ventilators sometimes. There are no medical treatments that we know to be effective. We are studying several of them, which may be a bit promising. I think it'll be a matter of at least weeks to months before we have any news on those. As every parent knows, children are very good at picking up respiratory viruses, and kids, even in a very contained setting at home, seem to be very good at passing them along to their siblings and to their parents. So it's a challenge. I think that unless you literally lock the kids in the house, it's going to be very hard to avoid it completely. What I think a lot of people have seen is that as schools are closing and children are staying home, they don't know what to do with the kids at home, and we're trying to find ways to entertain them without getting large collections of kids together. Of course, that would generate the problem you have in a school. So probably social distancing and isolation are the most effective because every parent knows that kids are always touching themselves everywhere and their hygiene is not always perfect. So I think the answer is probably social distancing. Hard question to answer. We don't have any science around it. I will tell you that one or the other would be absolutely a fantastic idea. If you can do really good hand washing, the 20 seconds of hand washing, that's very good. The detergent will break down the virus on your skin, and then you'll wipe it down with paper towels and throw it away. The hand sanitizers, and used properly, are also good and much easier because you just do a squirt and rub it into your hands. So it makes it easier to do it frequently. But I'd say a mix is probably the best. Washing your hands before eating, washing your hands after any kind of toilet activity, and then hand sanitizer when you're forced to touch surfaces in your in public space, especially in a building, elevator buttons, railings, all kinds of things. So I think a combination is the best. I think it's very difficult for children to, especially young children, to wear a mask and gloves. It's not so reasonable to ask for that. And remember, it's only effective when it's done properly. I see people with masks that are down over their lower lip. Well, that's not doing any good at all. The mask has to cover your nose and your mouth. I think also if you start to touch the exterior of the mask and then touch your eyes or your nose, then the mask also provides a source for the virus to go back into your body. So you have to be very, very careful never to touch the exterior of the mask when it's been in an environment that could become contaminated. So masks are tricky, and even health professionals who wear masks all the time sometimes struggle. Gloves are probably a little bit too much. I think that unless you're working in a setting where there's a very, very high risk, wearing gloves is just not practical in most cases. I think everyone's experienced in Italy, the US, China, and other countries that have been heavily impacted is that once the virus is in the household, it's very difficult to stop the spread within the household because people just share common space. They share environment that is very highly likely to transmit the virus. So once the person, whether it's a child or the adult is in the household, you do your best, you try the best hand hygiene, you try to sneeze into your elbow instead of onto your fingers. And hopefully that will do the trick. But if you can't do those things, you just have to be aware of the fact that there's a virus out there. It's much like other kinds of viruses, making you have fevers and cough and so on. It's hard to distinguish, and you just do the best you can and hope that the best you can is good enough. I'm going to ask you to think of it this way. Imagine that someone gives you a food you've never had before, and they ask you to tell you what's in there. You may have had all the ingredients in that food before, but it may be very hard to tell when you eat them all together what exactly is in the food. It's somewhat the same around respiratory viruses. Some combination of sore throat, fever, cough, sneezing, muscle aches can be present, whether it's a flu or a regular cold or this coronavirus. And generally, while there are sort of general rules around it, any individual person can be very hard to tell. So I would say that at least half the people, when they come to see the doctor or call the doctor, have a fever, and half of them don't. Of the ones that didn't have a fever, about half will develop a fever later. So fever is pretty common. Cough is probably the most worrisome and the most common feature. Runny nose, sniffles are not so common. Itchy eyes are not so common. So again, these are a little bit of clues you can get. They're not extremely reliable. I would say it's a difficult diagnosis to make with certainty based only on symptoms. I would tell parents in general that while this virus is very frightening and I would never make light of it, so far as we know, children tend to have much milder disease. They tend not to have to go to the doctor. If they do go to the doctor, they tend not to have to go in the hospital. If they have to go in the hospital, they tend not to have very serious hospital stays. So that's the good news, that children from infancy up into adolescence tend to hold the symptoms fairly easily and not to become very ill. Of course, I wouldn't have that child hang out with their grandmother or grandfather, because I wouldn't say the same is true of older people. So I think the best you can do is to look after the child with usual, rest and fluids and things you can do around the house, and then try to keep the child from infecting anybody, especially a relative who might be elderly, have chronic lung disease, have diabetes, or have immunosuppression. That most parents are going to hear concern from their children. The children have probably heard things about the virus that are very scary, and I think many parents are also scared, so this is a hard conversation to have. I think it's good to tell your children every day how much you love them and value them, and that you'll protect them as best you know how. And then as we learn more about this, like so many other infections, it becomes a little bit less scary. But no one's going to argue that it isn't frightening to children right now, and a lot of kids are having nightmares from what they hear on the news, what they hear from their friends and families. So try to be strong, try to be supportive, try not to be unrealistic, and reassure your kids that they're likely to be very, very healthy if they get the virus, but you're looking out for everyone's health too.